Amblyopia. Vision is a learned process that requires ideal conditions for proper development. If the brain receives abnormal or unequal visual input during infancy or childhood, it results in a condition known as amblyopia or lazy eye. A child with amblyopia doesn't develop the proper nerve pathway, as opposed to the unaffected eye that has developed more nerve pathways to the brain. As a result, the amblyopic eye will send fewer neuroelectric signals to the brain than the good eye. If left untreated, the pathways through which these signals travel may weaken and not develop properly, damaging the child's vision. Amblyopia is a loss of vision in one or both eyes that develops before the age of 6. It is caused by either an eye turn, a deprivation, or from refractive errors. Amblyopia affects the efficiency of the visual system as the patient loses their binocularity. Patients with amblyopia have reduced depth perception. It impacts one's reading and learning, sports abilities, and navigating through one's surroundings. Treatment options include a combination of eyeglasses, drops, vision therapy, and/or eye patching. During vision therapy, the patients learn to use their two eyes together as a team. Amblyopia can be diagnosed during a comprehensive eye exam. Early detection and treatment of amblyopia is an important strategy against preventing vision loss. All children should have a complete eye exam at least once between ages 3 and 5. The sooner children get treated for amblyopia, the better the prognosis is, since the child's brain is highly plastic.